right, and we are live, everyone. So good evening, everybody. I am Kelly Larson with the city's Human Rights Department, and I'm going to take just a couple minutes to get us all introduced here, and then we will go into our Q&A. So a couple of little details. If you are watching this on Facebook, you may go ahead and ask any questions in the comments on Facebook, and I will relay those over to the panelists. And any of you who are here on the Zoom also can ask questions of one another if you have things that come up as we're having the conversation. And I appreciate all of you for being willing to be here tonight. I am going to ask each of you to please just introduce yourself so that the people watching know who we have here on the call. So if we could, I'm just going to kind of go around the screen. So Dr. Carr, could you start, please?
Hi, my name is Wanaki Carr. I'm an OBGYN based in Davenport, Iowa. I work with Genesis Health Group. Been in Eastern Iowa for 3 years now. So happy to be a part of the panel.
Thank you. And Dr. Canaro?
Yeah, I'm Bobby Canaro. I'm a radiation oncologist. I've also served on the Board of Health here in Dubuque for the past year, and I've lived in Dubuque for over 10 years now.
Thank you. And Danielle?
I'm Danielle Moore. I work at John Deere, and I've been in Dubuque now for 15 years. Been with Deere for 16 years, originally from Detroit, Michigan, and I'm excited to join the panel tonight. So thank you for the invite.
Thank you. Jason?
Hello, my name is Jason Weston. I am a community member. I work at Prudential, been in Dubuque for 3 years now, by way of Philadelphia, Pennsylvania.
Thanks, Jason. Abhay?
Hi, everybody. My name is Abhay Raval. I've been in Dubuque for 9.5 years, and I work at John Deere, and I grew up in India.
Thanks, Abhay. Josh?
Good evening, everybody. Josh Napper, Assistant Chief, Dubuque Fire Department. I have been running the Chief of Operations for the fire department's effort in the several vaccine clinics we've had recently.
Thanks, Josh. All right, so with that, I'm going to ask you to introduce yourself, Collins, and then we can start off our conversation.
Sure. My name is Collins Zabo. I'm the Organizational Equity Coordinator with the City of Dubuque, working alongside the Kelly Larson in the Human Rights Office. Tonight, again, thank you, panelists. Thank you, community members, for really are all part of our panel here to better understand both COVID-19, the vaccine, and our understanding of the development of the vaccine and how we can better help our community understand how to engage both with each other and with their own personal choices as it relates to their own personal health and safety. Questions that we wanted to kick off to the panel are varied. They go through the development of the vaccine. They go through, again, our just personal decisions with the vaccine. A general question that I wanted to pose to our doctors to begin with: what are some of the most common side effects from the currently available vaccines? I think that's what is top of mind for many people these days, so I thought to jump straight into it. Dr. Carr, please.
Yeah, so right now, and we'll get into the types of vaccines later, but there are 3 types of vaccines out. There's 3 types. There's the Pfizer, the Moderna, and the Johnson & Johnson or the Janssen vaccine. The most common side effects that people may have either after the first or the second dose of the 2-dose regimens is fatigue, just feeling tired, a headache. Maybe the injection site is going to be a little bit sore, so it might hurt to move your arm that day, or you might have some stiff shoulder. Muscle aches. Some people do develop a fever. Those are definitely the most common side effects that you can potentially experience. A lot of those side effects end within a few days after receiving that dose of the vaccine.
Okay, thank you. As I said, we have other community members with us tonight, Danielle, Abe, Jason, that are going to ask questions to our panelists also. Could you jump in here, Danielle, with a question that you might have?
I guess I do have a question regarding the pause that they took on the J&J. Can you talk about that and what was the decision to release that pause?
Yeah, I don't mind talking about that at all. So the J&J vaccine, or Johnson & Johnson vaccine, was having essentially a very rare side effect, where essentially mostly women were having this cerebral venous thrombotic event. That's pretty rare and is not very common for lots of your average kind of ER doctor to initially recognize, because it can mimic other things like migraine, headaches, and whatnot. And so there were about, I believe, 8 or so cases of this rare blood clotting disorder that happened within 14 days after receiving the Johnson & Johnson vaccine. So of all the vaccines that have given out, there's about I believe it's less than 1 in a million chance that if you're a woman getting this, or a person who got this vaccine, that you could have this clot. But since it was such a adverse event that led to deaths, they decided to hold the vaccine, put a pause on it, reevaluate the data, see how common this was. And then the CDC recently decided to go ahead and release the pause on the vaccine and to allow people to continue to re-administer the vaccine, because the risk of that adverse event was so incredibly low. Now, with that said, the American College of Obstetrics and Gynecology has recommended that women between the ages of 18 and 45 go ahead, and if there's another available vaccine, go ahead and get that vaccine. They also say it's obviously your choice. If you are pregnant or postpartum, or if you're on birth control pills, just normal states that can increase our risk as women for developing a blood clot, they say they would recommend that you get a different vaccine if available to you. But of course, as they continue to study this vaccine, and as we continue to analyze the data, that those recommendations may change over time.
Thank you. Dr. Canero, the next question for you. Going back to side effects, we've heard from many of the community, again, apprehension with the side effects. As Dr. Carr mentioned, the rarity of the side effects from the Johnson & Johnson vaccine, but from the host of vaccines that are available, what are the most serious side effects from them, and how do those side effects compare to the effects of COVID-19? Some, of course, are saying that I'd rather not go through the side effects and I'd rather just take my chances.
Yeah, that's a good question. So if you look at some serious side effects that the vaccine can cause, outside of your typical side effects that are, I would say, low grade, such as just pain on your injection site, fatigue, headaches, those are fairly common. Usually they're mild, but some of those can also kind of manifest a little bit more severe in what we would call grade 3 or higher. And that can happen where someone experiences so much fatigue that maybe they're in bed for a day or two, more severe than what the typical person may experience. So sometimes that can happen, where the common side effects that you get from the vaccine are more intense for certain individuals. But when we're talking about potentially life-threatening side effects, there are a few of those as well, but they're very rare. One of them can be a severe allergic reaction, which we call anaphylaxis. The CDC suggests that anaphylaxis can occur in maybe 11 cases out of a million, so very, very low. But there are some people who are allergic to something called polyethylene glycol, or PEG, and that is found in some of the mRNA. It is found in the mRNA vaccines, so Moderna or Pfizer. So if you have an allergy to that PEG or polyethylene glycol, then it is possible for you to get a severe allergic reaction. The other one we talked about, such as blood clotting, again, as Dr. Carr was mentioning, that's also very rare. I believe out of 6 to 7 million people that were vaccinated, they only found 6 to 7 cases. So again, it's very low risk of that happening. But obviously, rare things like that can happen from time to time. Now, there's something to keep in perspective. Even common medications that we take, such as Tylenol and Advil and Motrin, can cause organ damage and ulcers and stroke and death. So they're rare, so we don't talk about them all the time. Actually, they're way more common than the side effects you would see from a vaccine. So just to keep things in perspective, there are a lot of things that we do take that can cause rare side effects. When we're comparing it, though, to some of the effects that COVID can cause you, I think it's not comparable almost, because what we're seeing with COVID is this whole other subgroup called COVID long haulers. And there's a significant number of people who have been infected with COVID that have had long-term symptoms that can last for weeks to months, that have affected or impacted many different organ systems. Some of those symptoms can be fatigue that lasts for weeks to months, brain fog, loss of smell or taste. I have some colleagues that still have not regained their sense of smell or taste even after 6 to 8 months. Heart palpitations, shortness of breath. So these are just some of those symptoms that have persisted for patients who have had COVID. Also, there's a condition called multi-organ inflammatory syndrome, where you have a whole host of several different organs within the body that develop an inflammatory reaction from COVID. And that can also persist for weeks to months. And even let's talk about blood clotting, because we mentioned that blood clots can happen maybe 1 in a million for someone that gets a vaccine. But COVID is known to cause blood clots. And if you take the risk of a blood clot with COVID, we're looking at about 165,000 people per 1 million. So 1 per million versus 165,000 per million. So it is a significantly higher risk of getting a blood clot with COVID.
This is actually a question posed from Facebook. Is blood clotting a concern if you're a male, or would you recommend getting a different vaccine?
So this is kind of piggybacking onto what Dr. Carr said. I think, from my understanding, and Dr. Carr, please tell me if I'm wrong, but I believe that young women are at a little bit of a higher risk of getting blood clots, and that's why they're specifically recommended to maybe try a different vaccine, especially if they're on birth control or things like that.
Yeah, those states, specifically pregnancy, postpartum state, increase your risk at baseline for a blood clot. You're much more likely to get a blood clot being pregnant or being in the postpartum state or being in labor than you are from getting the vaccine itself, even if you're not pregnant. And you're more likely to get a blood clot just being on an estrogen-containing birth control pill than you are from taking the vaccine. But they don't know if the combination of those two factors, whether it be pregnancy, postpartum state, or being on birth control, can doubly increase your risk to the point that you could potentially have this clot. Now they're still trying to figure out, what were the women who got these clots, were they on contraception? Where were they at, in terms of menses and all of that stuff. But I think in terms of men, maybe if you know that you have a known clotting disorder, you may want to think about it or talk to your physician about that. But otherwise, we think that overall it should probably be a very low risk. And the fact that those who had this clot were not men is also, I think, in the benefit to get that shot if you're eligible and it's available to you.
Okay.
All right, thanks, Colin. So I do have a question. With Pfizer and Moderna, there are 2 shots that you have to take. Can you talk about why the 2 shots and why is it really important to take both of them and not just the one?
Guess I can take that. Yeah, so in terms of how the vaccines were designed, they were designed and they were planned out and tested for 2 doses. Now we know that some people may or may not go back for that second dose. So that's how we're getting data in terms of how effective the Moderna or the Pfizer vaccine may be if you only take 1 dose, as we're getting that data potentially now. We know that you're going to probably develop some immunity from the first dose. I think there's been some studies that have quoted up to 80% for the Pfizer vaccine. But it's going to be even more effective and potentially may have a longer ability to protect you over time than if you just get 1 shot. So if you are only taking the 1 shot, you're not taking the medication or the vaccine as it was designed. And so you don't know necessarily the long-term effectiveness of it.
Thank you. And the second question?
Yeah, so the other thing, I've done some research on is with children and, when do you anticipate, children starting to get vaccine, and do you think their response to vaccination would be similar to what we have seen in adults? And Bobby or Dr. Carr, open to both of you.
That's a good question. I think we're going to have to wait to see what the studies show on children. I mean, right now we have data for 16 and older, but we really don't have good data yet on children. So I really can't comment on how they're going to react and how efficacious the vaccine would be for that age group. So we're going to have to wait and see.
Okay. Thank you.
We'll leave space for some of our other panelists. Jason, if you could step in.
Okay, one question I had was, so when you're fully vaccinated, can you still get the virus? And if you can, what's the advantages of having the virus as opposed to not having vaccine? So, if you can get it, what happens? And if you get it without it, obviously, it could be grave situations if you don't have the vaccine and get the coronavirus. But my question is, if you get the virus after you get the vaccine.
Go ahead.
So the way I would answer this is is by looking at the efficacy of a vaccine, right? And if you're looking at, let's just look at Pfizer or Moderna. They have an efficacy of north of 90%, 95%. What that means is that if someone is vaccinated with either of those 2 vaccines, that they have a 90 to 95% less likelihood of developing symptoms from the virus. It doesn't mean they're not going to get the virus. It doesn't mean that they can't get infected, but the chances of them developing symptoms or dying from that virus is close to 0. It's very, very low. Dr. Carr, would you answer that any differently?
No, I would agree with that. I mean, and essentially you're allowing your body to fight off the virus if you're exposed to it. If it gets in your system, you may never know you have it. So just now versus you not having the vaccine, you get exposed, you get the virus, there's a higher likelihood that you're going to have symptoms versus the Pfizer, Moderna, or even the J&J vaccine. The chance of you having a severe infection, landing you into the ICU or landing you on a ventilator is exceedingly low, exceedingly rare. And that's also why it's important to get those 2. If you're doing a 2 vaccine, one of those 2, the Pfizer or Moderna, that you're actually getting the full course and then really waiting those 2 weeks for that full immunity before you feel like you can just kind of feel like you're truly immune. Because that's, if you get your first vaccine, you don't go back for your second, you're a higher chance of having a symptomatic infection. So you have to weigh those benefits of and risk of not getting a vaccine or only getting one of the two vaccines if that's the type of vaccine you get, and potentially getting sick versus not having a vaccine at all, putting you at a higher likelihood to have all these complications from COVID.
All right. Kind of answered all my questions at this point. So, Collins, I'm gonna pass it back to you. And I had another one, but it just came up. I'll have to chime back in.
Sure, that's fine. Take your time. I'll actually pass it over to Daniel.
Okay. Can you talk about at all the efficacy of the vaccines against some of the known variants that are out there, such as the UK variant or the South Africa variant or the Brazil variant, as is being called? Can you talk about what is known or what data is known in terms of the efficacy of the virus against those variants? I'm sorry, the vaccine against those variants.
Dr. Canero, please.
I'll be honest, I don't think I can quote exact numbers for you on this, but from what we are seeing, at least, and it seems that Moderna and Pfizer are protective against the variants for now. And I'm not completely up to date on Johnson & Johnson at the moment. Dr. Carr, do you know? I'm not 100% sure about how effective it is against the variants.
I think for Johnson & Johnson, at least when they were first releasing the vaccine, I don't think it's quite as effective against the South African variant from what I have heard. But at the same time, it's going to be better than not getting anything at all. You're still probably going to have a potential for your body to recognize the virus and potentially not have as harmful of a disease. And they are, I mean, these vaccine companies, these pharmaceutical companies are doing the trials on these various variants as they arise. But viruses mutate fairly quickly, and this one seems to mutate very well. And I know they're talking, and this may be a later question, but I know they're talking that some of these vaccines may or may not need boosters. And so we'll see over time as we have more variants arise, if people are, taking precautions to help reduce the viral load around the world, we're going to see how effective these vaccines are over time.
So what these viruses are, well, I stepped in front of Danielle. You had a second question?
Yes, I do have a second question. So there have been some reports of the COVID, what they're calling long haulers that have those long-term side effects, that after they've gotten the vaccine, that some of them may feel better. Can you talk at all? Have you experienced that with patients, or why that might be, if that is the case?
Dr. Carr?
I mean, personally, I don't know of any long haulers that are kind of patients of mine that I'm aware of them having long-term symptoms, kind of like what you've been hearing, but I have seen like the news reports on it. Obviously, I haven't read those like journal articles and primary articles kind of talking about that, but I think there are definitely institutions who are studying that, like Mayo Clinic, who are looking at the long haulers and how they're doing with the vaccines. But yes, I have heard that as well, that the long haulers, some of them are getting better when they're receiving the vaccine. So I think it's depending on what type of symptoms these long haulers are having too. So I don't think it's necessarily all symptoms that people are having. Like in terms of, I think it's more neurologic symptoms that I believe from what I've heard, but I can't confirm like reading the articles myself.
Thank you. Dr. Canero, the next question for you. Going back to the development of the vaccine, what does fast track approval mean? Does it mean that these vaccines are riskier than vaccines that do not go through fast track approval? If so, to what degree?
Yeah, so good question. I do see this come up a lot. I think it's important, first of all, to understand that speed doesn't mean rushed. In this case, we leveraged a whole lot of smart people, money, and decades of previous work to get a vaccine developed in 9 months, which was really remarkable. What we fast-tracked were regulatory approvals, funding, data analysis, and some things that we had to submit to the FDA. So those were paperwork-related processes that we fast-tracked. We didn't fast-track patient enrollment, clinical follow-up, capturing adverse events. So the important things were not fast-tracked. What was fast-tracked was a lot of the red tape, the paperwork that goes into clinical trials. So I don't believe safety was compromised in any way.
Thank you. I'll hand things over to Abay, if you could.
Yeah, so can you, talk a little bit more about the efficacy of the vaccine and what does it mean? What does it not mean? We hear a lot about, the difference between Johnson and Johnson being a lower efficacy, but some of my, own research that I've done, the things that have come up are what the Johnson and Johnson vaccine was during a time when these other mutant variants were coming out. That's when the study was done, and that's why there's a lower efficacy number. So can you talk about that, either Dr. Carr or Dr. Conero?
Yeah, it's a really good question, and it's a complicated answer. When Pfizer and Moderna came out with their clinical trials, we were at a period in time where the virus was not completely out of control, and we weren't dealing with all of these variants, as you mentioned, and maybe it's possible that maybe that's why we had higher efficacy rates with Johnson and Johnson, as you mentioned. It came out at a time when the pandemic was really kind of exploding, and variants were also coming out, and that potentially may be why some of those efficacy numbers are a little bit lower. But regardless, something to keep in mind is that when we're looking at efficacy, if you look at something like the flu or a lot of other efficacy rates when we're looking at a vaccine, we're still well above what we would define as a successful vaccine for all of these. So I think that's important to note. Again, when how do we define efficacy? It's not that you can't get the virus if you get vaccinated. You can. But what the vaccine really is doing is it's protecting you from getting a severe infection, getting severe symptoms, and dying. Or it's reducing that risk significantly.
And I can piggyback on that with some numbers, because I'm not a numbers gal, so I have to write that stuff down to remember. When the companies first came out and kind of told us what their efficacy rates were in their trials, they said Pfizer was 95% effective in preventing symptomatic disease. Moderna was 94% effective in preventing symptomatic disease. And Johnson & Johnson kind of broke it down a little bit more into like symptomatic and how severe the disease process was. So 66% effective in preventing like moderate disease. So maybe you're at home, you have a flu-like symptoms, but you're not in the hospital. 77% effective preventing severe disease, and 93% effective in preventing like a prolonged hospital stay. So if you're thinking, it all depends on what metric you're looking at. Are you looking at symptomatic disease and how severe that symptomatic disease is? Are you looking at overall like mortality rate? And if you're looking at overall mortality rate, all these vaccines are great.
Thank you. Yep.
One other question I have, one of the things we've noticed with the COVID is that we have seen that people of color have been disproportionately impacted in the way of contracting the virus as well as deaths. Can you talk about why that may be for some of the minority groups. I've seen some data that said Asia, the Pacific Islander group, that they have been the most impacted, followed by the Latinx community, and then followed by African Americans. So can you talk at all about why people of color have been disproportionately impacted with this virus?
I think it's a complex issue. I don't think it's just one thing. I don't think it's just someone's health. I think it has to do with kind of the jobs that a lot of us people of color hold. A lot of us were essential workers who had higher risk of exposure, couldn't take that time off of work, can't work from home, so higher risk of exposure. Health conditions that may predispose us might be disproportionately higher in our communities, like obesity, diabetes, hypertension, that we think put us at higher risk of severe disease. And then you have just systemic racism within medicine that prevents people from seeking out care and maybe potentially getting the care that they need in a timely fashion. So I think all of those things together are contributing to why we were having higher rates of morbidity and mortality, especially early on in the pandemic.
Dr. Canero, could you add?
Yeah, I agree. I think it's a really complex issue, and a lot of it has to do with a lot of just different demographics, access to healthcare. Some of it may also be the difference in some genetic makeup as well. There's some theories about lower levels of vitamin D having an impact. So there's a lot of different. It's multifactorial. But I thought Dr. Carr did a great job answering that.
A related question that we're seeing from Facebook is, what percentage of people of color are vaccinated in the state of Iowa? How does that compare to the majority?
Can you repeat that question?
What's the percentage of people of color vaccinated? Hold on for a second. The percentage of people of color that are currently vaccinated in the state of Iowa, and how does that compare to across demographics? How does that compare to the majority?
I believe the number is lower. I just don't have exact numbers for you. Dr. Carr, are you familiar with exact numbers?
I don't have the numbers. I can tell you probably anecdotally, it's probably lower. Just talking to friends, family, and patients.
Kelly, is that something that you could chime in on?
I do, yeah. I don't have them for the state. I have some for Dubuque County, and these are from April 19th, so a couple of weeks. And if you look at the comparison of the numbers, the percentage of the Dubuque population. So if you take the Dubuque County estimates of the population broken down by race and ethnicity from the July 2019 census estimates, American Community Survey estimates, then you can see that about 41% of white residents in the county are fully vaccinated. About 9% of Black or African American residents are fully vaccinated. About 27% of Pacific Islanders, 10% of Asians, 14% of American Indians, Native Americans, and 8% of our Hispanic Latino population.
So I guess a related question to that, seeing those numbers being lower for African Americans, can you talk about what some of the reasons might be behind why those numbers might be lower? Is it access? Is it hesitancy given the history of medicine and things in the African American community? Could you talk about why those numbers might be lower? And then what can we do to get the education out there? So I know this is part of that. These are forums like this where people can ask their questions and get access to real data. But what else can be done to reach those communities that are disproportionately impacted yet not vaccinated as highly as they need to be?
I think it's a couple of things. I think access to care. I think especially initially when vaccines were first being offered, if they didn't have enough vaccines at the city or county levels, other people were able to, if they had a primary care doctor, were able to call their primary care doctor and get on a list. If you didn't have established care with someone, if you're somebody who wasn't already plugged into a healthcare system, it was harder for you to find a vaccine to start. I think that's changing, and a lot of the healthcare systems in Eastern Iowa are making it easier for you to get a vaccine. It's now easier to sign up at Walgreens or CVS to get your vaccine, as they have more of a supply now. So I'm hoping that in terms of access issues, that's being improved. I think some people had vaccine hesitancy just purely due to not understanding the vaccine, or feeling just kind of the historical distrust in the medical community. I just know even my family, they raised me to be a doctor. My dad, it was like pulling teeth to get him to agree to take a vaccine. And then finally he kind of almost got it by chance, his first dose, where he was trying to get a shingles vaccine, which he trusted that, but the doctor told him, maybe get your COVID vaccine first. So, and months of me talking to him and showing him that I was fine, now 4 months out from my vaccine series. So I think just our history in our country with how Black and brown and underserved populations have been treated has definitely, unfortunately, made people distrust the system. And for those who may not understand kind of the background about how the vaccines are created, and that this isn't something that this technology didn't come out of nowhere, that it's been being studied for years for all these vaccines, hopefully will help ease some concerns about the vaccines and their efficacy, and then how they may affect us as a people.
And I had a quick question, just to kind of piggyback off Dr. Carr and Mr. Nepper. I know you stated in your intro that you kind of help with the process of having the vaccination centers in the area. And Dr. Carr was talking about access. Are there areas down in the downtown region where some of those populations live, for the availability of getting the vaccine down there, instead of, those are the places that I know where the vaccine is, it's not down there. So could you weigh in on that?
I've been waiting for that question since I sat down. Actually, tomorrow at Audubon School, we are hosting a clinic from 4 o'clock to 7 o'clock. No appointments necessary. Just walk in. If you'd like to make an appointment, you're certainly welcome, or everyone's welcome. The means to make an appointment, if you have access, the phone number is 563-690-MAKE. If you can't make tomorrow, we're hosting one on Thursday, same time, 4 to 7 at the Grand River Center. Did that answer your question?
It did. And just off top of my, what vaccine they're going to be giving out down there, or is it?
I don't know for sure. I believe it's Pfizer, maybe Moderna, excuse me. But as a fire department, we're also very willing to help answer that question. It's a complex question, and what else we can do to break down some of those barriers that people have. We're quite willing to hear input. So thank you for the question.
I do have a follow-up to that. So as far as, it's a walk-in clinic, and you can just walk in. Do people need to bring any specific documents with them while they're going to this walk-in clinic? Also, could you maybe talk a little about the vaccination card that you get, and why that is important to save that and keep it on you, or keep it with you, and bring it for the second dose as well?
Sure. If you have a driver's license and if you have an insurance card, bring those with you. But they're not required. We're not going to turn people away for not having those documents. Our main mission is to get as many people vaccinated as possible. So if you don't have those things, no problem. You're still welcome to come. Yeah, thanks for bringing up the card. We do give you a card after you receive your vaccination. It says the location of the shot, the injection site, what was given, the date it was given. And that helps us, and it's a nice reminder for people when to come back for their second shot as well, or second dose. And it's your proof that you received the vaccine, that you're fully vaccinated.
Thank you.
Thank you. I want to go
Can I,
back.
oh, I'm sorry, Collins, can I just jump in for a second?
Sure.
On the question that was just asked about other downtown locations, I also know that Crescent Community Health Center will be having clinics coming up on this Saturday and next Saturday. And that the VNA is beginning to schedule clinics in various locations downtown. I don't have all of the details at this time, but if people watch our Facebook page, the Human Rights page, we'll put that out there as soon as we have specifics for that.
And
Thanks,
just,
Kelly. I wasn't trying to just pump my own. Thank you, of course. We're happy anywhere people get them. You don't have to just come to the fire departments.
and other than like this Facebook Live and this online, virtual platform, are these events being promoted any other way to get out to the community?
Kelly, I think you could probably answer that question better than I could.
Do you mean in terms of the clinics and things, Jason?
Yeah, in general, because I know we have multiple, we just gave 3 resources. Obviously if individuals don't have Facebook or access to this medium, how will they know this is available to them?
Yeah, so the information, I know it goes out through the county press releases that are done. At this point, I believe they've gone to Monday, Wednesday, Friday. Those have been happening every day. So the TH has been putting out information. Press releases go to radios, so I'm assuming some things are coming out there. I'm not a big radio person, so I haven't heard them if they are. The county and the city both have web pages up that have all the vaccine information. But honestly, probably the easiest thing for everyone is back to that phone number, because that call center number is staffed with people who can answer questions about when and where clinics are happening, and even help get people signed up if they need assistance, say with signing up with a pharmacy or something like that. And I think,
I know.
and
I
make
know
sure
I
I have this
received-
number right, 563-590 make.
690, correct?
Josh, could you put that into the chat for everyone? Okay, thanks. We have a couple of questions coming in through the internet pretty fast here, so we'll make sure we get to those before going back to what we had maybe for the meeting tonight. Dr. Carr and Dr. Canero, you've both talked about why people of color have been hit harder by the pandemic, by COVID-19. What can we do? What can we individually do and as a community do to change this narrative for our current health and for the next pandemic? Dr. Canero.
I think the challenge that we've had to deal with, I'm speaking on behalf of the Board of Health, for this past year, has just been the significant amount of misinformation that has been disseminated throughout media, social media. And we're in a culture now where experts aren't trusted. And a lot of non-experts sometimes bark louder, and they're heard over scientists and people who have dedicated their life working on handling these types of scenarios. So I think what we need to do is really kind of battle the misinformation better, have a more united voice so that we can avoid things like this in the future.
I'd agree. Just not going down the clickbait cycle of YouTube, listening to videos from somebody's mother's friend who had bad one-time thing that may or may not have been related, but she took the vaccine 2 days later or had the vaccine 2 days before. I get that a lot in OB when it comes to birth control and pregnancy complications and things of that nature. And I think it's really good if you have somebody in the medical system, in the medical community, in terms of a doctor or provider that you trust, have that conversation with them. Ask, be deliberate, ask questions to your healthcare provider so that you're informed. I don't think anybody expects our average patients to know all the ins and outs of the vaccine, can spout off the lipid organic formula of that. And I don't think you should have to, but staying informed and asking for the appropriate information and asking the right people and getting from the right sources, I think is key to helping you stay knowledgeable. So it's making those relationships. And then just as a community in general, making sure that we're staying up to date with our, like in terms of long-term longevity and health, just making sure we're doing what we can to keep ourselves healthy, having your annual checkups. Don't just go to the doctor when you feel like things are getting bad. Exercising and eating well will help us, everyone, stay healthier longer. And just doing all that routine maintenance that we all have to do. Sometimes we don't always like going to the doctor. Even me as a doctor, sometimes I don't like going to the doctor, but we have to do that to keep ourselves healthy and trust the experts.
Thank you. So going back for a second, we had talked about, or it was mentioned, some of the hesitancy and some of the reluctance to get the vaccine within our own families and within our own circles. Even more personally, Josh, I'll begin with you even. Did you have a hesitancy? Were there concerns about your own health and safety in taking the vaccine? Why or why not? And if I can ask, did you take the vaccine yourself?
I did take the vaccine, and my hesitancy early was I was unfortunate enough to have COVID in September. So my hesitancy was, should I continue with the vaccine or not? And that was my only hesitancy, really. And I'm glad I did get vaccinated. The only side effect I have was some injection site soreness, sore shoulder. That's it. But largely the people around me haven't been or haven't communicated that they're hesitant. That may be just that they know that I'm part of the vaccine, part of vaccinating the community, and they're not going to bring those issues to me. But hopefully that answers your question. I like the dialogue, and I think that's part of getting down to why reaching the community and finding out what the root of the hesitancy is.
That hits it right on the head. And even a question to everyone on the panel. This isn't a question just for our providers here. This is a question for all of us. If anyone would like to not step forward, but to share about their own hesitancy or their own feelings or experience with taking the vaccine.
Yeah, I can share. I honestly, I did not have hesitancy. I was like, the first opportunity I'm going to get it, sign me up. Because I want to end the pandemic. I went over a year without seeing my family because they're up in age, didn't want to risk passing anything to them. So the way to end it is to get people vaccinated. So I was ready. I wanted it. I did get the Moderna vaccine. I did have side effects. So after the first dose, I just had a sore arm. And then after the second dose, I had a headache and I was fatigued for about 8 to 10 hours. But then after that, I was fine, but it wasn't anything terrible. It wouldn't make me not recommend anything. It really wasn't that bad. I unfortunately know too many people who have passed away from COVID, being from Detroit, being from Michigan. Michigan is a place that's been hit hard. Detroit, I lost a family member. So it's personal for me because I want people to live. And I've had to do the same kind of education with my family. I've had to talk to my mother. Mom, don't look at that YouTube video. Like, you don't know that lady. You don't know the story behind it. Let's go talk to your doctor. Let's find somebody you trust. So Dr. Carr, I think you hit on a very important point when you said you have to have somebody that you trust, because I feel fortunate in that I can trust my doctors. I have, I sit on the board of Mercy, so there's access to doctors there. So I have access to people that I know and trust, and they're giving me data, and they've gotten it themselves. So I think that's hugely important that you have somebody that you trust, that you can go talk to and get the real information. So I've had to do a lot of that education. I'm thankful that my mother did go ahead and get it. The rest of my family has gotten it as well. So I think it's hugely important that we work to end the pandemic, and get back to a life where we can be with each other, be safe, and not worry about spreading a daily virus. So that was why I was ready to get it whenever I could. And that I did research and I had access to that information. So I wasn't worried about it, but I understand that people are. And so I am passionate about that education piece of finding somebody that you know, and getting that education and having the facts at your disposal to make a good decision. Because the worst thing I think people can do is make a decision off of bad information, make a decision not to get it off of false information.
So I can talk about my experience as well. I did get the Pfizer vaccine. My wife is a teacher, so she got the vaccine way before me. But we also did some research. We did read up on how the vaccines work, what's the science behind it, and how well they work. So that a lot of that information, and you'll find there's a lot of misinformation as well. So just go with what you trust, find trustable sources. We talked about peer-reviewed papers a lot, so that there's a lot of good information in those. And from my side, side effects, it was just sore arm, kind of just a dizzy head for a while, and then it was done. So, and again, just my biggest thing was let's end the pandemic together. Let's get it done. It's not that bad at all. Get your shot.
Well, I think one thing that comes intuitively to Dr. Carr and myself is when we're looking at we're looking at studies and we're making clinical decisions all the time. And what we look at, when we're making those clinical decisions is how good the data is that's presented in front of us. And really the gold standard for any type of clinical decision is a randomized placebo-controlled trial, right? That is the gold standard. If you have a study that is designed in that kind of fashion, that it's a high quality, trustable study. And these vaccine trials were done as randomized placebo-controlled trials. So because of that, I had I was fairly confident that I could trust these results. So it's important for people who are maybe on the fence or who are unsure that there's a lot of garbage data out there as well. There's a lot of poor studies that can be done. So you want to look for the gold standard type of trials and studies to make your decisions. And fortunately, these vaccine trials were really well done that way.
Jason, were you about to share?
Oh yeah. So I initially wasn't going to take the vaccine because I have a weird kind of thought because up to 2 years ago I didn't even get a flu shot, and I'm pushing 41 years old because I figured, hey, while I'm young, let's not take any medicine. So when I get older and I need it, it works. So, but I got to thinking about it. That through my job, I'm on an airplane a couple times a month, and what's going to happen to my family if I get it and I check out, and I'm not here to take care of my family. So that, and my wife did all the research. She's smarter than me. So she, did all the research and figured out what she thought was the best vaccine for us to take. And I took it. It was the Pfizer vaccine, and I had a little bit of soreness on my arm, but that's the only side effect I had. I didn't have any lightheadedness or anything like that. So, I think the decision is to each his own. I have family members that don't trust it, and I obviously, just like anything else, politics, religion, everything like that, they're entitled to their own opinions, and I don't judge people and tell them what to do, but make the best informed decision for yourself. And for me and my family, I thought it would be the best thing for me to take it.
I think, yeah, the key is making an informed decision. You may ultimately decide that you don't want the vaccine, but make sure you're making that decision based on actual facts. So, and I always tell people, I don't think, doctors should be telling patients what to do based on their personal opinions. They should be telling you, or, advising you based on actual facts and scientific data and evidence-based medicine. So they shouldn't be telling you what they think you should do. They should be presenting all of the options that you can make an informed choice, an informed decision about what you put in your body, or what procedures, or for whatever it is, whether it's a vaccine, whether it's a procedure, you should be able to make an informed decision with your provider. I know I always tell people, okay, they think about it as the guinea pigs that they're not even guinea pigs in terms of the first people in the general public who are allowed to get the vaccines were the healthcare providers. You're not gonna, if the government, or if you're really concerned that a vaccine or a medication that's going to be given out to a large group of people is, could potentially be harmful. The last people that you'd want to give it to are the people who are there that could potentially save someone's life. So the fact that they were like, hey, we need to give it to these healthcare providers or people on the front lines first, made me feel, okay, if they feel so confident in this vaccine, then maybe it's something that we should do on top of looking at the facts. So now that your healthcare providers, they've also gone through that experience personally, most of them, and have gotten the vaccine. Now there are definitely people who haven't. And so just think about like that too, that there have been people before you in the general population who have gotten, who are doing very well, who also had some had a lot more knowledge to kind of make that decision early on.
Thank you. We're running short on time. We're running up on time, I mean. This will be our last question. It comes from the internet, from Facebook. And I think in some ways this was answered, but still I'll leave this last question to you, Dr. Canero. If I decide not to get the vaccine from a 30-year-old male, I'm wondering if I do decide not to get vaccinated, is my risk of dying from the virus high, or would I potentially survive? Also, if I did survive, what long-lasting side effects would I have to live with?
I wish that was a easy black and white question I could answer, but I can't. A lot of times people throw out the stat or this percent that there's less than a 1% chance of dying from COVID. But that's actually very misleading. If you really get into the numbers and dissect things, it's a much more complicated issue. Last year, COVID was the third leading cause of death. So you have to understand that a lot of people died from COVID, and a lot of people are living with the long-term effects of COVID still. So and sometimes it's not always easy to predict who are the ones that get these long-term symptoms, and even the ones that die. So there is a risk, obviously, that you're running even if you're younger, if you decide not to get vaccinated. That's number one. Number two, if you get the vaccine, you're also less likely to transmit the virus to other people. So there is also some community benefit that you're doing on a selfless level, where you're helping others by getting the vaccine, not just yourself.
This has been a great conversation. Absolutely. In making personal decisions, as you just said, in making community choices, as Dr. Carr, Danielle, Josh, Jason, you all said, COVID-19 is with us, but we need to make decisions for our personal health, for our community health, to make sure that it doesn't stay with us. Kelly.
Yeah, so I just want to take a minute and thank all of you as well. I really appreciate you taking the time to be on the panel tonight. It allows it to be shared through Facebook and other people to hear the conversation as well. So thank you all very, very much. And for anyone watching, you can pass along to people the link off of our Human Rights Department Facebook page for anyone else who may want to watch the video afterwards.
Josh, for one quick second, Josh, could you reiterate resources of the community, how to sign up, phone number, how to ask questions, and where to go to close this out?
Yeah, thanks again. Great dialogue, everybody. Again, thanks for all the panelists for joining. This was fantastic. The number is 563-690-MAKE. MAKE or 6253. And if you don't want to call, they can really direct and guide you where you need to go. But if you don't want to call, just stop by Audubon School tomorrow between 4 and 7 or Grand River Center between 4 and 7. And we're not going to turn you away.
Thank you. And again, thank you, everyone.
Thank you.
Thank you, everyone.
Thank you.
Good night.
Bye. Good night.